Hi there, my name is Erin Unger, and I'm a physician assistant working in obstetrics and gynecology at Mount Sinai Hospital. I'm here to discuss the two most common oral progestins used to treat endometriosis, Visan and Norlutate. If you've made your way to this video, it is likely your healthcare provider has discussed starting oral progestins to help with your symptoms. Oral progestins are a synthetic or medication form of our naturally occurring hormone progesterone. My goal with you today is to help you understand these medications. Why are they taken? How do they work? And how do you take them? What can you expect after starting these medications? So let's start. Why are progestins prescribed for endometriosis? Endometriosis is when the lining of the uterus is found in the pelvis and outside the uterus, and as a result, it causes inflammation. The goal of medical treatment for endometriosis is to suppress the expansion of endometriosis implants. Additionally, we aim to stop ovulation. By doing this, we can prevent the growth and shed cycle of endometrial tissue and endometriosis tissue. It is this growth and shed cycle that can cause a lot of the inflammation, pain, and scarring seen with endometriosis. So let's talk about oral progestins. How do they work? Oral progestins like Visan and Norlutate work in four main ways. The first way oral progestins help with endometriosis is by decreasing the total estrogen production from the ovaries. As you may know, estrogen is a hormone that fuels endometriosis. So if we decrease estrogen, we can improve endometriosis symptoms. Progesterone as a hormone inhibits the expansion of endometrial tissue and thus inhibits the growth of endometriosis. Progestins also have an anti-inflammatory effect, which can help reduce your immune response to endometriosis and therefore hopefully reduce your pain. Progestins also work directly to target endometriosis implants by preventing the formation of new blood vessels. This is something we call an anti-angiogenic effect. You may wonder, why did my doctor prescribe a progestin over a combined hormonal contraceptive like birth control pills? Birth control pills are effective at reducing endometriosis symptoms in approximately 30% of our patients. When they take the pills continuously, this means you don't have your period. This is nice when contraception is also desired. However, for many of our patients with endometriosis, the birth control doesn't adequately improve your symptoms, and this is likely because the estrogen in the pills is fueling your endometriosis. Progestins are wonderful for treating endometriosis because not only do they work directly on the endometrial tissue, but progestins also decrease estrogen and starve the endometriosis of its fuel. If your endometriosis symptoms are not improved by birth control pills, it is important to promptly switch to a progestin-based medication. So, do we have evidence that oral progestins work for treatment of endometriosis? In short, for suppressing endometriosis, yes, we do. They do work. They have tracked bladder nodules and ovarian cysts of endometriosis, and they do shrink in size. They may also fully resolve. But what's most important is that we have great evidence that patients feel better. They have less pain. And this is what our main treatment goal is. So remember, not all pain may be coming from your endometriosis. Any endometriosis medication may not fix all pain symptoms. Sometimes pelvic pain is multifactorial, so other interventions like pelvic floor physiotherapy may be needed. Okay, so how do I start my Visan or Norlutate is something I get asked a lot. Once you have your prescription, you start taking the pills on the first day of your next period. Why the first day? First of all, we want to make sure you're not pregnant. Second, we know that by starting the medication on your period, you're less likely to have irregular bleeding. We recommend taking it at night, but any time of day with or without food is okay. Just try to be consistent with timing from day to day. So what can I expect after starting Visan and Norlutate? Wonderful question. The most common side effect after starting progestins is irregular bleeding. This occurs mostly in the first 3 to 6 months of starting the medication, and I like to think of it as your uterine lining readjusting itself. This bleeding is typically nuisance bleeding, but it is unpredictable and it shouldn't be overly heavy from day to day. Over time, it reduces to irregular spotting, and after about 6 months of medication, about 1/3 of our patients stop having periods altogether. Of note, your first period after starting Vizan could be very heavy and longer than normal as your endometrial lining adjusts to the new medication. Contact your doctor's office as there may be some medications to help with this first period. For example, tranexamic acid. If you are filling a maxi pad side to side and end to end within an hour for 2 or more hours, then your bleeding is too heavy and you should go to the closest ER. Other common side effects my patients report include headache. The headaches my patients typically experience on progestins are similar to tension headaches. For folks with migraines, you will read on the product monograph that you should not have this medication if you have migraines. This is not true. Neurologists who treat migraines are comfortable with progestin medication use. Some patients also experience breast discomfort when they are taking progestins, similar to when your period is about to come. These medications do not appreciably increase breast cancer risk for those with a family history. However, you should not take progestins if you have a personal history of breast cancer in the past. A minority of patients may experience hot flashes. This is due to the decreased estrogen in your body, and it actually means that the medication is working. These usually go away with time and are self-limiting. So what about mood? Progestins can cause mood changes, namely depression. Mood changes are reported in 3 to 5% of people on Vizan. But remember, endometriosis pain and heavy menstrual bleeding themselves can impact mood. If the medication helps your pain, your mood may also improve. It's good to have your family doctor or a counselor in your care team to help support you. If you have significant mood deterioration, please contact your doctor's office so we can evaluate you. Finally, many patients ask me, will this medication make me gain weight? When you look at all of the studies put together, there is no significant increase in weight in patients on progestins compared to those patients taking a placebo. So what else about Vizan and norlutate should I know about? Let's talk about pregnancy and reproduction. So the first question we have is, are Vizan and norlutate considered contraception? They are not technically approved as contraception. Since progestins inhibit ovulation and thin your uterine lining, pregnancy is very unlikely. But if you do not want to get pregnant, you should use some other form of contraception, like condoms, when having sex that could result in a pregnancy. So how soon can you get pregnant after you stop Vizan? On average, patients report that their periods return to normal after 2 months from stopping the medication. Ovulation can return as early as 1 month or the cycle following your discontinuation of Vizan or norlutate. If you get pregnant when on Vizan, there have been no noted adverse effects on baby when the pregnant parent was taking Vizan. You should just stop Vizan when you find out you are pregnant. So, some other people are concerned, will an oral progestin help my fertility chances? Possibly. Some data suggests that shrinking or preventing recurrence of endometriosis on the ovary results in an increase in ovulatory function and egg quality. In our practice, we have many patients who are on progestins to treat endometriosis for a longer term, such as greater than 2 years. We have long-term data that shows that progestins are safe for long-term use. The only issue is that they can be associated with a slight decrease in bone mineral density. We are not entirely sure what this means for future fracture risk, but evidence shows that bone density returns to normal upon discontinuing progestin medications. We can help support our bones when on progestins by taking vitamin D 2,000 units daily and calcium 1,200 milligrams a day, either from food or calcium supplements. Weight-bearing exercise, decreasing alcohol, and smoking cessation also help protect and strengthen your bones. You guys are all probably saying, Erin, enough. Give me the TLDR. So here it is. First, progestins are safe overall, even for long-term use. Second, progestins are effective at reducing endometriosis growth and endometriosis-associated pain. Third, progestins are generally well tolerated once our bodies have a chance to adjust to the new balance. Remember, it's important to give these medications time to work. We counsel everyone to try it for at least 3 to 6 months, as hormone medications generally take time to reach their full potential. Many of our patients are very happy with their endometriosis symptoms on Vizan once they've been adjusted.